Vitamin B12 is an important B vitamin. It is crucial for nerve tissue health, brain function, and the production of red blood cells. Cobalamin is another name for vitamin B12. A deficiency or insufficiency can occur when levels of vitamin B12 becomes too low to meet the demands of the body. This can lead to a number of symptoms and can even progress to irreversible neurological issues if left untreated. In the United States and the United Kingdom, approximately 6% of adults aged 60 or younger have vitamin B12 deficiency. The rate jumped to 20 in people older than 60 years. Vitamin B12 is a water-soluble vitamin, like all other B vitamins. This means it can dissolve in water and travel through the bloodstream. The body can store vitamin B12 for up to 4 years, and it can get rid of any excess or unwanted vitamin B12 in the urine. Vitamin B12 is the largest and most structurally complicated vitamin. It occurs naturally in animal products like meats and eggs, and manufacturers can produce it through bacterial fermentation synthesis. This video explores the function of vitamin B12, how a person would know that they are not consuming enough vitamin B12, and how to increase intake. Benefits: vitamin B12 is crucial to various bodily processes, including normal functioning of the brain and nervous system, cognitive functioning, ability to think, formation of red blood cells, and anemia prevention, helping create and regulate DNA, possibly preventing cognitive abnormalities, helping protect the eyes from macular degeneration, necessary for energy production. Vitamin B12 is essential for healthy blood. When the body does not have enough B12, it leads to decreased normal red blood cell production, anemia, which impairs oxygen delivery. Megaloblastic anemia, also called nutritional deficiency anemia, is a type of anemia caused by B12 or folate deficiency. Megaloblastic anemia is characterized by impaired DNA synthesis and the formation of large, abnormal, immature red blood cells. Intake requirements. The National Institutes of Health (NIH) recommends that teens and adults over the age of 14 should consume 2.4 micrograms of vitamin B12 daily. Pregnant people should consume 2.6 micrograms and lactating people 2.8 micrograms. However, people should speak with their physician before starting any new supplements. Some medications may decrease the absorption of vitamin B12 from foods. These medications include metformin, proton pump inhibitors, H2 receptor agnostics, often used for peptic ulcer disease. Foods. Vitamin B12 occurs naturally in many animal products. It does not typically occur in plant foods unless it is supplemented. Good dietary sources of vitamin B12 include beef, pork, ham, poultry, lamb, fish, especially haddock and tuna, dairy products such as milk, cheese, and yogurt, some nutritional yeast products, eggs. Additionally, manufacturers fortify some types of plant milk and breakfast cereals with vitamin B12. Even though vitamin B12 is found in a variety of foods, some people are at an increased risk of developing B12 deficiency or insufficiency. Groups at an increased risk include older adults, those on restrictive diets like vegan diets, people with certain health conditions such as celiac disease. Deficiency symptoms. Having low or deficient B12 levels can lead to a number of symptoms, some of which can be serious. It can result in irreversible or potentially severe damage, especially to the nervous system and brain. This, however, is uncommon. That said, even slightly lower than normal levels of vitamin B12 can trigger symptoms. However, these symptoms are non-specific and are not enough to diagnose vitamin B12 deficiency. Symptoms may include depression, confusion, memory loss, fatigue, headaches, mood changes, difficulty concentrating. Once symptoms worsen, they can include neurological changes such as numbness and tingling in the hands and feet. Some people may have difficulty maintaining balance. Infants who lack vitamin B12 may show unusual movement such as face tremors, reflex problems, feeding difficulties, irritation, eventual growth problems if left untreated. B12 deficiency has been linked to an increased risk of cognitive impairment and depression. Insufficient vitamin B12 can also lead to anemia. The most common symptoms of anemia are fatigue, shortness of breath, and an irregular heartbeat. People with anemia might also experience a sore mouth or tongue, weight loss, pale or yellowing skin, diarrhea, menstrual problems. Who is at risk? Several groups of people may be at an increased risk of vitamin B12 deficiency. Vegans face a risk of vitamin B12 deficiency as their diet excludes animal-sourced food products. Pregnancy and lactation can worsen deficiency in vegans. Unless a vegan diet is carefully planned, it is difficult to get enough vitamin B12 through plant foods alone. For this reason, it is recommended for those following vegan diets to supplement vitamin B12. Anemia is an autoimmune disease that affects the blood. Patients with this disorder do not have enough intrinsic factor IF, a protein in the stomach that allows the body to absorb vitamin B12. Other at-risk groups include people with small intestine problems. For example, an individual with a surgically shortened small intestine. Crohn's disease is also a risk factor for vitamin B12 deficiency due to frequent involvement of the terminal ileum. Gastritis, celiac disease, and inflammatory bowel disease (IBD) may lead to a deficiency because these conditions reduce nutrient absorption. People with chronic alcohol disorder may lack vitamin B12 as their body may not absorb nutrients efficiently. People with diabetes who are treated with metformin should have their B12 levels tested by their healthcare professionals regularly. This is because metformin reduces the absorption of vitamin B12. Treatment for vitamin B12 deficiency include oral vitamin B12 supplements or vitamin B12 injections. Supplements. Some people have difficulties absorbing vitamin B12 from food sources and may need to take supplements. Some population may have problems absorbing vitamin B12 from food, including older adults, people with pernicious anemia, those with intestinal disorders. People can take B12 supplements orally or in nasal spray. However, oral supplements may not help in many cases of deficiency. In these circumstances, a doctor may recommend vitamin B12 injections. Vegans and others who do not get enough vitamin B12 from their diets can take supplements to avoid deficiency. This is particularly important during pregnancy and while breastfeeding. People can purchase various vitamin B12 supplements in health food stores and online. That said, supplements are not FDA regulated and people should be careful when taking them and ensure they purchase them from a reliable source. Injection. Doctors may prescribe vitamin B12 injections for some individuals with pernicious anemia or issues with vitamin B12 malabsorption and severe deficiency. These injections consist of vitamin B12 in cyanocobalamin or hydroxycobalamin forms. A healthcare professional typically administers these injections into a muscle every other day for 2 weeks or until the individual symptoms improve. Continuing treatment depends on if the cause of the deficiency relates to diet or if the individual has any accompanying neurological problems. Side effects. Doctors do not consider vitamin B12 as toxic in high quantities. Hydroxycobalamin injection may cause side effects, including pain, swelling or itching at the injection site, nausea or vomiting, headaches, dizziness, hot flashes. Serious side effects are rare. However, if people experience palpitations or signs of allergic shock after an injection, they should contact their doctors immediately. Summary: vitamin B12 is an essential vitamin mainly found in animal products. Most adults require 2.4 micrograms daily. The body needs vitamin B12 for normal function of the brain and nervous system, the formation of red blood cells, and other critical processes. Deficiencies in vitamin B12 can lead to symptoms like headaches, fatigue, and digestion problems, and can even lead to nerve damage and cognitive issues. Some people are more at risk of deficiencies, such as older adults and those who do not absorb nutrients well. Vegans may also have a deficiency risk, as their diet excludes many B12 sources. Most people who eat a balanced diet receive enough B12. For others, doctors may recommend oral supplements or injections. Hi, thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more contents like this, kindly like, share, leave a comment in the comment section, and also please subscribe to this channel if you have not subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.